Today from New York, this is New to the Street.
MedeFile International is a healthcare technology and services organization enabling people to create and maintain their medical records. Joining us to talk about his company is CEO Kevin Hauser. Kevin, thanks for joining us.
Thanks for having me, Ken.
So tell me about MedeFile.
MedeFile is an electronic personal health records company whereby on behalf of our members, and of course along with their authorization, we go out, we do the actual gathering, digitizing, indexing, and organizing of any and all an individual's medical records from any doctor, hospital, or healthcare facility so that they have full, complete control over their medical records 24 hours a day, 7 days a week from virtually anywhere in the world.
Tell me about the history of the company.
About 11 years ago, unfortunately, my grandmother was diagnosed with colorectal cancer. She was a widow living in South Florida. My father, my entire family, were up from north. He'd have to fly down to South Florida, take my grandmother from doctor to doctor, and in doing so, every doctor that he took my grandmother to required that he have all the previous records from all the other doctors. He'd go back to New York, wait till the records arrived, and this type of pattern would continuously go on and on. Finally, unfortunately, my grandmother had passed away. He set out on a personal goal to create a system and service that was designed for us, the patient, so that when and where we needed our medical records, MedeFile would have them.
Now, I have to tell you, as a lifelong patient, as everybody is, you, me, the crew, everybody watching, when I go to a doctor's office, I like to see things that are modernized. And I've been to doctor's offices in various parts of the country, leading up to where I live now, and everything seems antiquated. You go in, the first thing I notice is the shelves in the back of the office filled with paper folders with scribblings on it that are records of people. That scares me.
Yeah, the paper walls. Unfortunately, we see a lot of digitization in all various different industries. Unfortunately, though, the healthcare industry has not been very quick to adopt to the digital age. There is federal mandate by 2014 to have all providers use electronic medical record systems, and we certainly hope the adoption rate will move a little bit faster than it has.
Now, staying on the subject of the federal government setting a goal to creating an electronic health record for every American by 2014, tell me about the marketplace and the barriers that MedeFile has encountered to reach that target.
Well, I think that the mandate, as important as it is, it's going to be a difficult task. And a couple of things that I think stand in the way is, number one, cost. Some of these electronic medical record systems can be very costly. And as we both know, although there's incentives for these doctors, the cost can still be very cumbersome for these doctors. And with reimbursements, the way they've been cut, doctors are not making what they used to make. The other problem I see is that doctors who have been practicing for quite a while don't want to have to change the way they practice medicine. And I assure you that putting an electronic medical record system in their office will require these doctors to change the way they practice medicine.
And when you talk about cost, can you really put a price tag on breathing and living?
I certainly don't think you can. And this is, you're talking about the market for MedeFile is the multi-billion-dollar market. Virtually every American should have, at least in our opinion, a MedeFile, a longitudinal record for any and all of their medical information, health information throughout their lifetime.
Now, I see you brought a literal example of what MedeFile is and what people are paying for. Show us.
This is actually the MedeDrive, which is a portable USB thumb device that, when inserted into any Windows-based PC, will automatically load that individual's emergency medical information. Now, individuals can go onto our secure website and access any and all of their own information 24/7. They can do it from any mobile platform, the MedeDrive, and just recently we were approved by Apple in the App Store to have our free MedeFile emergency app for all existing members.
Now, I see you're also wearing another example of MedeFile technology. Show us.
This is the same type of technology, a USB silicone bracelet that we offer our members as well. And for me, if in the event I don't have my keys on me, the one thing I know that I always do is have my bracelet.
Now, we're talking about errors that cause a lot of problems, in some cases can cause unfortunate fatalities when it comes to doctor-patient, patient-doctor, medical community. Give me examples of medical errors that MedeFile is working to correct.
Well, first, let's look at the statistic that most people don't even know, that they're not aware of. Medical errors is one of the leading causes of death in the United States, between the 5th and 8th leading cause of death. And a good portion of those fatalities and injuries are due to medication errors. So you might have a doctor that writes a script for a patient, and unfortunately those doctors are very often not communicating with other doctors, and another doctor would write another script for the patient. Those could have a potential drug-to-drug interaction between each other. So one thing that we did in our system is when we built our database, as soon as an individual enters a new medication, it queries through to search if in fact there is any drug-to-drug interactions that may exist, and if there are, we alert you instantaneously with hazards on the screen.
Now tell me how MedeFile attracts members.
We actually have 3 different business models: a business to consumer, business to business, and what we coin the provider to consumer. We currently maintain an online email and telemarketing campaign direct to the consumer. We have the B2B model, in which we work with organizations, groups, large entities, and of course the payer systems is one of the entities that we're looking to work with on behalf of their insured. And the provider to consumer network, so that we work with doctors and physicians groups to educate and market our services to their patient base. Because of course we believe if your doctor tells you that something's a very important thing for you to do, we expect and we hope that those patients will of course go ahead and take their doctor's advice.
So it's all about medical stability for the company.
Without a doubt.
Tell me about the company's fiscal stability.
Well, currently we are doing a great job going out there and selling product. We started really marketing in the middle of last year. We're very, very pleased with the way that our sales have grown. Our internal forecast and intention is to be cash flow positive by the end of the year. We're very pleased that the company is completely debt-free.
We spoke before about HIPAA and the company's concierge. Tell me about those 2 points.
Well, HIPAA being the federal mandate is certainly a very important thing. Although MedeFile is not subject to HIPAA because we're not a covered entity, we take every precautionary measure to meet those standards and exceed them. Our concierge is really a wonderful tool. For those individuals out there that think I'm too old or they're not very computer savvy, our concierge is designed to help those individuals through phone interview, through booklet format, where they can either conduct a phone interview with one of their concierge reps or fill out their information in booklet form and then have our staff do, of course, the data entry. But really from a common sense standpoint, our concierge is even designed so that if in fact the adult daughters and sons of some of our members want MedeFile to check up on their moms or dads or grandmas and grandpas, our concierge will call 3 times a day sometimes to make sure that mom and dad are okay.
So it's not only clicking, it's calling, clicking, personal interaction, which you don't get a lot today.
Without a doubt. We really employ the KISS method. We really try and keep it very, very simple.
Where do you see MedeFile in the short term versus the long term? Balance out both. Short
term, we continue to see some real excellent growth in the marketplace. PHR industry, only about 7% of Americans currently use personal health records. So we continue to see some real enhanced growth over the short term. In the long term, we look for MedeFile to be the consumer brand name in the personal health records industry.
Now, the upside for this is limitless. I don't really see a lot of downside to having your records accessible as quickly, conveniently, and precisely as possible. I see no downside.
You and me are completely on the same page, Ken.
What would you say to somebody who's pondering whether or not to use MedeFile?
Well, I can say with very clear certainty that as we sit here today, that yourself, your parents, children, every viewer that's watching this show at some point will without a doubt need their medical records. So it's not a personal sick record. We're a personal health record. So the time to start gathering and consolidating any and all of your information is not when you're sick. It's when you're healthy. And if we just take a look at the devastation that's happened in Japan, and we see that a very good portion of that region, chances are, lost their medical records for good. Well, the United States is vulnerable to the same type of destruction and devastation that we see there. It's not just earthquakes. We saw it happen with Hurricane Katrina. Close to 1 million people lost their medical records for good. We want everybody out there to become proactive, to become empowered to utilize that tool that is available to everybody. That's probably the most important one, and that's, of course, information.
So MedeFile is both electronically and people-friendly at the same time. You're integrating both.
Without a doubt. Without a doubt. And we have the ability of talking and being interoperable with various different electronic systems out there, so it makes it very seamless for some out there.
All right. He is Kevin Hauser, the CEO of MedeFile. Kevin, thanks for coming in.
Thank you for having me, Ken.
And for more information about MedeFile, you can visit MedeFile.com. We'll be right back.
New to the Street, brought to you by MedeFile International, will continue in a moment.